Welcome, everyone. This is our first session that we've had in a few months. Congratulations on everyone surviving the brief pause in the federal government. So what we're going to talk about today is the human subjects sections and the vertebrate animals sections. I'm going to remind you all of our past ways that we've done this. We do not make the slides available, but we do record the session and we will post it up on our YouTube channel, usually within 5 business days. So it's sometime next week. I'm Paul Murphy. I'm the co-director of the Shore Resource Center along with Dr. Brett Spear. Brett is in Europe at the moment, so he will not be joining us today. And our first speaker is going to be Kathy Grutch, who is our Executive Director of UK's Proposal Development Office. What we're going to do is we're going to do the human subjects section first, and then a slightly shorter session on vertebrate animals and do Q&A at the end. Okay, take it away, Kathy.
All right. Well, thank you, Paul. Welcome, everyone, to this session on human subjects and vertebrate animals in R16 grants. So we're starting here with setting the stage for human subject studies in the R16 grants. And essentially, we have a few goals here to distinguish between human subjects research and an NIH-defined clinical trial. This is one of the challenges for completing the human subjects and clinical trial information form. And so we'll cover some details on how you know where you are situated. To understand the basics of completing the human subjects section of the NIH R16 grant applications. In recent years, NIH has consolidated all types of relevant human subjects detail in a single form, and it can seem intimidating, but I think as we work through this, you'll see that it's fairly systematic, fairly methodological. And then to navigate the form itself, which fields are text fields, which ones require narrative attachments. So NIH R16 does support human studies. You may propose research involving human studies if the study does not qualify as a clinical trial. And we're going to do a deep dive into that distinction. So you'll notice when you look at your notices of funding opportunity for the SURE mechanism, each title will say R16 clinical trial not allowed. If you inadvertently submit a clinical trial, your proposal will be returned without review. And so it's really important that you make that distinction as you are planning and developing your proposal. So what is a human subject study? You know, this session is primarily on proposal development, but let's step back a bit and look at how NIH defines human subjects research, which is essentially research involving a living individual about whom data or biospecimens are obtained, used, studied, or analyzed through interaction or intervention, or it is identifiable private information that's used, studied, analyzed, and generated. And this NIH infographic gives a number of examples of human research: collecting blood, conducting a survey, changing participants' environment, administering medicine, interviewing, administering a psychological test, collecting data, conducting a focus group, testing a new educational technique. And essentially, it says here, included in the NIH application, protection of human subjects attachment. This is a huge piece in the human subjects and clinical trial information form. But as I said, that form consolidates a whole lot of relevant details, so there's much more to it. If you are funded as a grantee, you will need to have an institutional federal-wide assurance with the Office of Human Research Protections, IRB approval or determination that your study is exempt from federal regulation, and human subject training and education. There's a great link that gives you access to this NIH infographic and more details on what is considered human subjects research. But I also really strongly advise that you work with your Office of Research Integrity and your IRB on your own campus, because there will be specific policies and procedures that'll be in place for you as an investigator on that campus. So the question that I come across in my role in the proposal development office very, very often is my human subject study a clinical trial? And it seems like it's obvious. It's like, well, I'm not doing a drug study. I'm not testing any kind of drug. Um, but the truth is you may be surprised. NIH clinical trials can range across a wide breadth of funding mechanisms. They can be mechanistic studies, they can be exploratory developmental studies, they can be pilot or feasibility studies, other interventional studies, they can be behavioral. And I'll give you some examples from our campus. So we had an investigator who was working with a rural community and was doing a dietary intervention that had been submitted to the IRB as a standard human subject study, and was very, very surprised to find that this fairly simple, straightforward study actually met the definition of a clinical trial. So the protocol had to be withdrawn and rewritten as a clinical trial study. So this study was to take a group of elderly individuals in this community, have them participate in a dietary intervention, which was not hugely intensive or a huge change from their standard diet, but emphasize bringing in more fruits and vegetables. And there were pre-tests for certain non-invasive health measures such as blood pressure, and then post-test, periodic tests and post-test. So this was in fact a clinical trial. Another example, another community intervention was a walking program. The group basically was given, sort of a walking regimen. There was a certain designated park that they were using. There were some pre-assessments of their health status, again, very non-invasive. There were periodic checks of these health indicators and a post-assessment, and that too was a clinical trial. So this was very surprising to that PI. So you really want to look at, how NIH defines a clinical trial. A research study in which one or more human subjects are prospectively assigned to one or more interventions, which may include placebo or other control, to evaluate the effects of those interventions on health-related biomedical or behavioral outcomes. So NIH has come up with 4 questions that identify whether a study is a clinical trial. So early in your planning process, you are going to want to work through these questions and ensure that your study that you're hoping to be supported by an R16 does not rise to the level of a clinical trial. So the questions are, does your study involve human participants? Yes, you're thinking it's a human subject study. Are the participants prospectively assigned to an intervention? Is the study designed to evaluate the effect of the intervention on the participants? Is the effect being evaluated a health-related biomedical or behavioral outcome? If you go through these questions and you answer yes to all 4, then your study meets NIH's definition of a clinical trial, and it would not be eligible for R16 support. If you have 3 yeses and a single no to any one of these questions, then it is simply, other than question 1, human subjects research and not a clinical trial. So 1 no answer keeps it from being a clinical trial. This is not always easy. And so NIH has put together a decision tool that has a number of sample case studies that can be really, really helpful. And I thought it would be useful for us to look at a couple. Here is case 7A. This is actually a scenario that happened on our campus. The study involves the recruitment of research participants with disease X to test an investigational in vitro diagnostic device. It is designed to evaluate the ability of the device to measure the level of an antibody in blood. So questions, does the study involve human participants? Yes, the study involves human participants. Are the participants prospectively assigned to an intervention? No. in this context, the IVD would not be considered an intervention. This IVD is being used to test its ability to measure antibody levels, but not to test its effects on any health-related biomedical or behavioral outcomes. So in our case, on our campus, we had a professor who had developed an instrument to assess blood flow non-invasively in complex medical conditions affecting, say, the brain. And he had patients, he had a clinician as a collaborator. It was invasive to some degree, but not entirely. And he was going through these rigorous tests of this instrument. But in his case, like this sample, he was really investigating what is the capability of this instrument? Is it effective at what we think it can do for human health? And his questions, his research questions were not about impact on the patients or a biomedical or behavioral health outcome. And so while it seemed to be clinical research, it was not. So this study is not a clinical trial. Here's another one. A study will test the feasibility of a mobile phone app to increase physical activity. A group of sedentary individuals will use the app for a week while their interactions with the app are monitored. The number of interactions with the app will be measured, as well as any software issues. Participants will also complete a survey indicating their satisfaction and willingness to use the app, as well as provide feedback for improvement. The app's effects on physical activity, weight, or cardiovascular fitness will not be evaluated. So does the study involve human participants? Yes. Sedentary individuals will be enrolled. Are they prospectively assigned to an intervention? Yes, they will interact with the app for a week. Is the study designed to evaluate the effect of the intervention on the app on the participants? No. While the participants' interactions are monitored, the study is not measuring the effect of using the app on the participant. It's only measuring the usability and acceptability of the app and testing for bugs in the software. This is not a clinical trial. It could be submitted for R16 support. So you do this early work, you assess whether you have a human study that does not rise to the level of a clinical trial. You're confident that you've answered these 4 clinical trial questions and you have at least one no answer. So you're ready to begin preparing that proposal. You've decided which R16 opportunity you're pursuing. You must respond to that notice of funding opportunity or NOFO and the SF 424 R&R application instructions, and every NOFO will provide the link to the SF 424 and the particular version that applies. This is really important because the details on how to complete the human subjects component of your application are in the SF 424. Now, it's important to note that right now we are using version I. If you look in the upper right corner where I've circled SF 424 R&R version I, this one took effect after January 25th, 2025. That is the version that is currently in use by NIH. And since R16 is a research grant, you are going to use the research instructions. You see that circled on the left, and the PDF, which you can click on to access that version. There are multiple versions of the SF 424, so it's important that you pick the right version. When you look at the 424, there is a section R220 that helps you fill out the R&R other project information form. This is on page R-34. And the first question it asks you is, are human subjects involved? And you're going to check yes. And then you're going to go through the rest of these questions. Now, our purpose today is not to talk about exempt research, because we're talking about non-exempt. We're talking about studies that would fill out the complete human subjects form. So you fill out accordingly to how your study is set up. The important thing about this response is that it will pre-populate the human subjects and clinical trial information form for you. So you're checking yes for involvement of human subjects, and you're completing the remainder of the form as appropriate. Okay, the next section that is really dedicated to human subjects component is the section R.500 PHS Human Subjects and Clinical Trials Information. And you can find that starting on page R-46. This is very detailed guidance to help you work through this form. So you follow the guidelines, and essentially it's step by step how to complete the human subjects and clinical trial information form, which is a separate attachment in your electronic application package. So what is this form? It's basically a form that consolidates in one single document called a study record, all details on human subjects involvement, including such sections as your protection of human subjects plan, eligibility and inclusion criteria, plans for inclusion across the lifespan, plans for inclusion of women and minorities, an inclusion enrollment report, a retention and recruitment plan, and more details. So let's take a look at these in more detail and the specifics of the form. So the other thing I like to share with people is this is a dual use form. So it is for studies that involve human subjects but are not clinical trials. But it is also for studies that involve human subjects and have answered yes to all 4 of those clinical trial questions, meaning they are clinical trials. So you, as an R16 applicant proposing a standard human subject study, not a clinical trial, can just disregard the questions that are required for clinical trials. And I'm going to point those out to you. So the form requires you to differentiate a human study versus clinical trials by answering those 4 questions. So you had already worked with those questions early on as you were planning your proposal to make sure you're eligible for R16 with this study. Here in this form, you are documenting that this is not a clinical trial. So you are answering these 4 questions. Does your study involve human participants? Are the participants prospectively assigned to an intervention? Is the study designed to evaluate the effect of the intervention on the participants? Is the effect being evaluated a health-related biomedical or behavioral outcome? And I really like to explain, because a lot of people get confused. What is a study record? The study record, that term refers to the whole set of data elements about a research study involving human participants. There is one study record for each distinct study protocol. So that means in any given proposal, you might have more than one study record. So multiple study records are possible. But you really want to try to avoid that scenario if you can, because the workload in preparing multiple study records is significant. So if possible, you lay out your interventions as arms of a single study protocol rather than as separate studies. Now, for an R16, which is a fairly constrained grant, with a budget that does not allow for a huge project scope, it's unlikely that you would have more than one study record. So here you are, you're preparing the form, you have a study that does not meet the definition of clinical trials. You are only completing items 1, study title, through item 3.2, multi-site study of this study record, because the rest of the form is for those people who are conducting clinical trials. So you remember you checked yes on that other project information form. It pre-populated the human subjects and clinical trial information form. So now you have yes pre-populated there in this form. And so you are ready to add a study record, remembering that you're only working on sections 1, 2, and part of section 3. Now, the one thing I like to point out to you is that this form, the yes answer on this form, came from that other project information form. So if you change that designation in that other form, you could lose any data that you enter here. So you want to be really careful in preparing the form that you don't lose some of your data. So here you see it says, please attach human subject study 1. This does not imply that you have to have more. It's just your starting point. All right, so I really like to give people a sense of everything they have to cover in a human subject study in this form, because it's kind of bewildering if you're just trying to go through step by step and figure out, well, when do I do the next, what's next, what all do I have to cover? There are 3 basic sections. Basic information, where you give some details, you give your study title, you indicated if it's exempt from federal regulations. Remember, we're saying we're doing non-exempt studies because we are talking about studies that really have to address this whole form. If it is exempt, however, there's an exemption number. Clinical trial questionnaire. Even though you know it's not a clinical trial, you're still going to have to answer those questions in the form to show the reviewers and the program staff at NIH what your assessment is of the type of study this is. And again, this is not a clinical trial, so you will not have to answer the clinicaltrials.gov identifier question. Then you have study population characteristics. This is where you start to do your deeper dive into what your study is all about. You'll have your conditions or focus of study, what the disease or condition is, so you might say diabetes mellitus, eligibility criteria, inclusion and exclusion criteria. This is a text field that is limited to 15,000 characters. You'll notice that there's a mix here. Sometimes you have to fill in a text field. Sometimes you do a drop down of a yes or no. Sometimes you have to go off and write up a document and attach it as a PDF. So you want to be really alert to what each field requires. You put in the age limits, you do inclusion of individuals across the lifespan, inclusion of women and minorities, recruitment and retention plans. So right in a row, you have 3 PDFs you're attaching. You are going to talk about where you are in the recruitment status, study timeline, which you can attach as a PDF. You enter a date for enrollment of your first participant. Once you are awarded the grant, you have a table that has your inclusion enrollment demographics. And then you go to section 3, which is the protection and monitoring plans. And this is where you write up all the details about how you are protecting the human subjects who participate in your study. And the final question that you answer is this a multi-site study that will use the same protocol at more than one domestic site? So for example, if you are collaborating with someone at another university and both of you are doing the same protocol, this is a multi-site study. This is not them doing just, one aim of the research at their location and you're doing the rest of it at your location. So this is what the form looks like, except you'll notice there are some little round circles in red and blue. This is just like for training purposes, a coding. You see that even if you were doing a clinical trial, you would be filling out the same initial information in sections 1, 2, and 3. And in blue, you see human subjects. You're filling out the same initial information as someone who's doing a clinical trial. Now, again, this is your study record. So this is a set of data elements about a research study involving human subjects. So each proposed protocol has its own study record. And again, you'll see you put in the study title, you indicate if it's exempt. Remember, it's already been pre-populated as human subjects. And then you come in here and you answer those 4 questions that we've just covered in the previous 2 slides to show that there is at least one no, and this is a human subject study, not a clinical trial. That takes you to section 2, which is the study population characteristics. And here's where you start to provide those details: conditions or focus of study, the eligibility criteria. You move into, you might be saying what types of individuals are eligible for your study, what types would be excluded. You have 500 characters for that field. For the age limits, NIH has a new policy. It's newish, I shouldn't say new. It's been around for a couple of years, but it's inclusion of individuals across the lifespan. And for that, For example, let's say you're studying some disease, maybe it's some cancer, and you decide it's just more convenient to have the maximum age be 65 and the early age 40. But if the truth is that people younger than 40 get that disease, or people older than 65 get that disease, NIH does not accept that you are arbitrarily limiting the age limits. So they are going to expect you to make it as inclusive as possible, all the way down to children if necessary. And so you will follow those age numbers, the minimum and the maximum, with an attachment describing how you arrived at what that is. Now, what we're seeing is maybe sometimes children are excluded because maybe it's the disease is heart disease and children don't really present with heart disease. So you might have an adult population, but you would not arbitrarily cut it off. And so a lot of our researchers are putting 99 plus as the upper age limit. Whatever it is, if you do need to exclude any population, so let's say onset of this disease really is in a certain adult window, then you would explain that in that attachment. There's an inclusion of women and minorities. I'm going to talk about that again a little bit more in the next one. You're going to talk about how you recruit and how you retain people in the study. That's an attachment. Recruitment status. If this is a study that you are planning for this grant to fund, you really want that date not to indicate that you're already recruiting because you're jumping the gun. And we actually have had a grant pulled here at UK for someone who thought it would look good if they showed that they had started recruiting people before they got the grant award. So be careful there. A study timeline, which is optional if it's not a clinical trial, but it can be very nice. And then a table of demographics. So let's look at those things. Again, individuals of all ages are to be included unless there's a strong justification. Now, sometimes the justification to exclude children would be they need to be able to read at a certain level, or they need to be able to do something. Again, disease onset is uncommon in children. But whatever, you have a rationale that's reasonable, and you're not just excluding people because it's more convenient to have people under 65 or whatever upper age you say. And then whatever you have specified, you describe the expertise of the team and working with those ages, the facilities to accommodate the age range, and the potential of the age distribution to contribute meaningful data. And of course, inclusion of children requires special protections. That's covered on page R109. There's been a lot of confusion about this next point, inclusion of women and minorities. I think it's pretty well known now that the federal government is saying that singling out marginalized communities is not a federal priority. So a lot of people thought that this no longer applies, but that's not true. The federal priority is all populations. So you still have to write an attachment explaining how you will include women and minorities because if it's a disease, of course, that's in both sexes and affects all people. And along with, your recruiting strategies. So that brings you to the inclusion enrollment report. And this is where you actually specify how many of each demographic you expect to recruit and have participate in the study. Now, you may have a hard time with some of these numbers. If you can't get the exact demographics, you can use an estimate from the population percentages in your region. Okay, that brings us to section 3, where you're writing the protection and monitoring plans. This is where you actually attach your human subjects narrative section. And you answer that final question, 3.2, is this a multi-site study that will use the same protocol to conduct a non-exempt human subjects research at more than one domestic site? You checked yes or no. However, you no longer have to provide a single IRB plan. NIH no longer requires that. So there are 4 topics in this attachment: risks to human subjects, adequacy of protection against risk, potential benefits of the proposed research, importance of knowledge to be obtained. These are reviewed as additional review criteria, meaning they're not directly scored, but they can be considered and are considered in arriving at an overall impact score. So you really want to be careful and conscientious about the way you prepare this section. It covers things like synopsis of study design, details of human subjects, involvement, population details, procedures, materials, risks, informed consent, benefits, adequacy of protection. So you really see how detailed this is. You're going to want to spend a fair amount of time on this. Keep in mind that the risks may be physical, psychological, social, cultural, privacy related, legal. You would address any that apply. And in many cases, PIs are in the position of saying the benefit is not to the individual, that the benefit is societal. So these people will not benefit directly necessarily. Some PIs are tempted to say, well, we're going to compensate the subjects. That is not considered a reasonable benefit. NIH does expect you to complete this form first, mainly because you do not want to duplicate information in the research strategy that you provide in this form. In the research strategy, you will, however, have to provide your power calculations, your sample size detail, not provide that here. Some aspects of the study are peer reviewed as part of factor 2, which is a scored criterion, and that's rigor and feasibility. And that would be your overall human subject study design, the inclusion plans, and the recruitment and retention. Some people often ask me, well, I want to have a separate bibliography and references cited in the human subjects, the protection of human subjects attachment. You are only allowed one single bibliography and references cited. So if you cite references here, anywhere in this form, you merge them into that single attachment later in the proposal. Again, you end with section 3.2. The rest of those are for clinical trials. This sample on the NIH website is a really nice example that can help you see how someone who was awarded a grant laid out a human subject study. You'll notice those clinical trial questions. It was yes, 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 no. So there was that single no that allowed it to be a human subject study, not a clinical trial. I'll close by saying there are lots of resources out there. There's the human subjects policy topics, wide breadth, NIH training resources. If you are using specimens, human specimens and/or data, there are some instructions on that. And then about the simplified peer review framework, which we have covered in other presentations in the SURE program. And with that, I will sign off. Paul, I think we want to take questions at the end, correct?
Yeah, we're going to wait till the end because
Yeah, I
otherwise
think
it
that
might
would
get
be. Okay, so let me just close
sidetracked.
out here and let Paul start.
There we go. Okay, hello everyone. I'm not only the co-director of the SURE Center, I'm also the iCook chair at the University of Kentucky, and I think about animal stuff all the time. I'm also a study section chair, so I also review plenty of vertebrate animal sections. Thankfully, this is a lot easier than the human subjects one, so it shouldn't take nearly as long, so hopefully we'll have plenty of time for questions at the end. So we're going to do this as two components. We're going to learn a little bit about different problems that come up a lot of times and how to avoid them, and how to complete both the two small sections in the actual application for vertebrate animals as well as the vertebrate animal section itself. So these parts are SF424 research and related other project information form, which is just a little checkbox. I'll show you where that is. And then the PHS 398 cover page supplement, which covers method of euthanasia, which used to be part of the vertebrate animals subjects section, but is now a separate place that you check elsewhere in the grant. And then we're going to talk about the vertebrate animals section itself. So the SF424 spot where you check animal research is here right underneath the place where you check our human subjects involved. This is very simple. Once you check yes, you need to indicate whether or not IACUC review is pending or approved. So if it's approved, then you put the approval date in there. They don't need the protocol number or anything like that. But you do have to provide your institution's animal welfare assurance number. So if you answer no, that the IACUC review is pending and not actually approved, then you can provide the approval date if you have it, but the approval date has to be within 3 years. Now, you don't have to have IACUC approval at time of submission, but you will have to provide proof of it as part of the just-in-time process when an award is pending. So it does take time to do that, so make sure you don't leave it too long. This varies by institution. Our institution typically takes about 2 weeks to approve a protocol. And you also have to do things like a congruence check. We're not going to talk about just-in-time stuff today, although if we have time at the end and you want to ask a few questions about it, we can do that since it's also important for human subjects. The second check place is on the PHS 398 cover page supplement. And this is where you indicate euthanasia method. So some animal subjects projects do not require euthanasia, so it is a yes/no answer. If you click the box that says are vertebrate animals euthanized, then you have to indicate that they are consistent or not consistent with the AVMA guidelines. The AVMA guidelines are available online. It's quite lengthy. It is somewhat surprising these days to find a method of euthanasia that has not been covered somewhere. If you do have a method of euthanasia that is not covered in the AVMA guidelines, either as acceptable or conditionally acceptable, you have to explain what it is and provide a scientific justification. And this gets reviewed separately by the Office of Laboratory Animal Welfare. So that can create a significant delay for your proposal. Again, that is a rare occurrence, though. Okay, so you do have only 1,000 characters for that, so be cautious with your space. Now, you don't have to enter the animal welfare assurance number for collaborating institutions anywhere here. If you do not have an animal welfare assurance number for your institution, when your authorized organization representative signs, they are essentially declaring that they're going to submit an application for an animal welfare assurance number when requested. If you're actually doing the work somewhere else, then you can provide that through what's called a memorandum of understanding or an additional contract type negotiation. We can come back to that later, but that's generally not all that common at this stage. All right, so the meat of your vertebrate animals component of your grant is the vertebrate animals section, or VAS. So this is generally not super long. Most commonly, these are about 1 to 2 pages. 2 pages is pretty common. You have to be very careful not to use it to circumvent page limits. Reviewers are very sensitive to this, as are the administrative staff. Also, you should be aware that NIH may release information within that vertebrate animals section via a Freedom of Information Act request, so do not put proprietary information in the vertebrate animals section. So you have to include a concise description of the procedures of live animals. This is the first component of the vertebrate animals section. So while you can put additional details in the research strategy section, you want to have descriptions of the procedures here as well as the number of animals used. And the description has to include sufficient detail so that the reviewers can understand what it is that you're doing. So the things that are important here are to include things like the species and strains of animals, their ages, their sex, and the total number used by species. And you also have to include the source of the animals if you're proposing the use of dogs or cats. And this is because there are a different set of regulations associated with dogs and cats regulating use of random source animals. So this is a quick example here. I'm not going to read it off to you, but generally you have a paragraph description that would describe the types of animals you're using, their strains, their sex, their age range, why you're using a particular type of animal, things along that line. There's a lot of parallels here with the human subjects section, although much simplified for the use of vertebrate animals. Keep the information upfront and prominent. So when you have specific procedures that are really critical to your grant proposal, make sure you get them in a prominent place in the vertebrate animals section so reviewers don't have to hunt for them. So the next thing you do is after you cover the population, essentially using the type of animals and their ages and sex, you want to summarize what's happening to the animals. Usually the best way to do this is to lead with the non-invasive procedures, things like blood draws, observations, veterinary examinations, those sort of things, which are not invasive procedures. And then follow that up in the next section or next paragraph with invasive procedures such as surgical ones. Remember, you only want to provide sufficient detail for the reviewers to understand what you are doing and that they can appreciate that you're doing it well. You don't have to go overboard on this. Now, power calculations are allowed to be included in the vertebrate animal section. They actually used to be specifically designated for this section, but what's happened to those over some years now is that the power calculations need to be included in the research strategy section itself. That's because it's an important part of evaluating the rigor and reproducibility of your grant proposal application. So there's nothing wrong with it including it in two places. But the most important part for the vertebrate animals section is to include the total of the animals. So this is where you would provide a description of the animals used in each aim and the total numbers in each experiment that you're using. So reviewers can see the total amount of approximate animal use for the proposal. Now, walk the reader through how you arrived at the total and any other considerations that you're using, such as attrition. Remember, keep this simple. I have seen people go incredibly overboard on this. I've seen sometimes people have 3 or 4 pages of detailed descriptions of what they're doing in their proposal, as well as detailed descriptions of how they're calculating the animal use for each aim and experiment. It doesn't need to be quite that extensive. Now, a coherent but brief description of the proposed use of the animals has to be provided in that vertebrate animals section. And there has to be sufficient detail, right? But anything that is really important for the reader to understand as part of your research strategy has to be in that part of the grant. So don't put things in the vertebrate animals section that are critical for your reviewer to understand what you're doing in your experiments themselves. That can sometimes be a subtle distinction, but it's very important because reviewers are not going to necessarily see that if it's in the wrong place. Now, once you get to a very long vertebrate animal section, you start to get reviewers being suspicious that you're trying to get around page limits. So don't have that happen to you. Have a good reason for what you are putting into that section versus the research strategy section. And, be cognizant of the fact if you're going really long, it may raise some questions. Remember to be sure to identify work being performed at other locations and explain transport considerations if necessary, how the animals are getting from one site to the other. Remember, if you're working with dogs or cats, you have to describe the source. So be really careful if you're proposing to use animals that are not purpose-bred for research. So now the US government principles require that you consider alternatives. And we'll come back to this at the end, and this is a question that we're getting a lot recently with some of the changes in NIH priorities for animal research. You need to provide a good rationale for the species that you're using, why you're using this one and not others, particularly, for example, why you're not using non-vertebrate animals such as worms or flies or anything along those lines. So the justification for the number for animal sex, ages, and other biological variables has to be described here along with your justification for use. Now, a lot of times the justification for use can be relatively straightforward. If you're using mice or rats, because they're not covered by the Animal Welfare Act, they're not what's considered a USDA covered species, the justification is generally the bar is a little bit lower for those. But what you do have to do is explain carefully why you are not only using this particular animal for your research, but why you are not using other alternatives, right? So if you are, for example, proposing to use non-human primates, then the bar is much higher. So you would have to explain very carefully why this is the appropriate system to be used in your study. Now, remember, mice and rats, and in some circumstances, birds are much easier to justify because generally speaking, they're not USDA covered species. Not all species of mice are. Mus musculus are not covered, but other types of mice are. So, for example, some types of mice that are imported to the US. So be aware that there are some subtleties in there. Now, if you're proposing to use any animals that are not mice and rats, remember what I said earlier about things being FOIA through NIH. So NIH frequently gets requests for release of information on grant applications through the Freedom of Information Act. And these are generally, they do not deny these at all. So usually through when Freedom of Information Act requests come for a grant proposal or part of it, they'll ask the PI, does anything need to be redacted? And the bar can be quite high for redaction. So unless it's proprietary information, they will just release it to whoever requests it. The last component in the VAS section is minimization of pain and distress. So you have to identify procedures or circumstances that may result in anything more than momentary discomfort, distress, pain, or injury. And you want to focus on how you would ameliorate or attenuate that injury. So pharmacological and interventions such as pain relief of various forms, either NSAIDs, perhaps opiates, or various other types of things you may use to alleviate stress. Be careful to describe humane endpoints, how the study would end if an animal is in distress, special husbandry requirements, identify procedures that are modified or refined from other procedures to minimize injury as opposed to past procedures. All of these issues are very important for things like surgeries in particular. If you're going to propose more than one surgery on the same animal, you have to be well justified in doing that, right? Because you have to describe things like potential complications and adverse reactions and how you're going to mitigate those. So be as clear as possible when you're explaining both the general care of your animals, both pre and post-surgical care. Again, this does not have to be super extensive. It just has to provide enough detail that the reviewers and the reader can appreciate that you've considered the issue and that you're taking it seriously and you're providing a good standard of care, right? This is both pre and post-surgical, as well as how you would deal with various complications. For example, if you're using a genetically modified mouse line and you know that some of the genetic mutations that have been incorporated into the mouse are going to lead to some health problems that you need to monitor and mitigate if necessary. Okay, now it's no longer necessary to include that method of euthanasia in the vertebrate animal section itself. Remember, sometimes it is included in the context of humane endpoints, so you can mention it in there if you think it's worthwhile. If you have no relief for pain or distress, this is what we call a category E procedure. You have to provide a strong scientific justification. Remember that any procedure or health status that would be considered to be distressing or harmful in a human is also considered to be equally distressing to the animal, right? Now, if you're using animals for more than one procedure that causes more than momentary pain or discomfort, so for example, multiple surgeries, you have to again provide a strong scientific justification, right? Remember, the justification has to be scientific. It can't be something like cost savings or convenience. Those are not acceptable justifications. All right, a few last words, then we'll move on to Q&A. Remember, the vertebrate animal section is considered by reviewers when they rate an application, but it's not given a separate score. So that means if a good vertebrate animals section is essential to a good grant application, and all that's going to happen is if you do a poor job, it will adversely impact your score. It can't make it better, but it can make it worse. Regardless of when you are planning experiments in a proposal, so if you have an R16 that you are not planning on doing animal studies until the 4th year, you still have to get all of your animal activities approved for the award to be made. So even though a lot of, for example, IACUC protocols are only last for 3 years and you have projects planned with animals in a fourth year, you still have to get those approved up front. Okay. Now, institutional policies differ on what is required to be approved before an award can be made. So be sure that you know what your institution allows. So some institutions will allow a conditional award to be made and just not allow you to access the funds for animal use until approval is obtained, but that is by no means universal. My institution, University of Kentucky, does not allow that. Okay. Remember, there are a few ways to make things go faster in regulatory scenarios, so make sure you know how long things take to get approved. And I will say one last thing about the changes in NIH priorities regarding animal projects, and then we can do Q&A. And that is, remember, they haven't really changed any of the regulations or rules for animal studies. What they've been making clear recently is that they're going to be more carefully evaluating things like the justification for the choice of your animal model and careful considerations of the alternatives. So a lot of systems, for example, if you're studying a complicated disease process, there isn't a good in vitro system and there isn't a good computer model for that. But you shouldn't deal with that in a dismissive way in the vertebrate animal section. You have to carefully explain why you can only use this model or why it is better than all others. And that's acceptable, right? And we can do Q&A on that and answer more questions if you have some specific ones in mind. And I am going to stop here and then we can go to our Q&A session. Okay. Usually these are going to be all for you, probably, Kathy.
Okay. So it looks as though the first one is, does development and feasibility test count as, I'm seeing that means clinical trial, even if it is just pre-post test for feasibility? Really, you can't answer that except in the context of those 4 questions. You have to ask those 4 questions about the study to know whether it's a clinical trial, and it has to be a yes answer to everyone. So really, just the category of study is not sufficient to help you decide that. Does health-related modify biomedical or behavioral or just biomedical? It modifies both of them. So it's a biomedical, a health-related biomedical outcome or a health-related behavioral outcome.
I'll comment on the slide since some folk may have missed that at the beginning. We do not typically share the slides. What we do have is we make a recording of the session and the recording is available on our YouTube channel, typically within about 5 business days, so sometime next week.
So the next one is, who makes the determination at proposal stage that a project is exempt? We had an issue when we applied for our R16 because we needed the IRB to make that determination, but that isn't usually done until just in time stage. So you use the guidance, and I gave you the infographic where you can study the explanations, and there's a flow chart to determine if it's exempt. There are a couple of scenarios that are exempt that require you to complete a little bit of the human subjects form. However, you should have an administrative office that supports your IRB, and they should be able to advise you because really every campus has certain policies. And so it's really important that at your campus level, you have made that determination as well. All right, let's see what else. Okay, I'm guessing this one refers to the one about the health related. Yes, this is, health related behavioral outcome. Okay, next one is for you, Paul.
So our institution has never received NIH funding for animal research. We do have a proposal that went in that has been approved by ICOG, but the ICOG does not have a federal assurance number. Since we haven't received funding for animal research before, it's understanding that if the grant is awarded, NIH will reach out. That is correct. If you can submit it without having a PHS assurance number, and if a grant is awarded, they'll actually negotiate with you to get a PHS assurance established. It actually is not as awful as it sounds. Does it mean that we are allowed to do animal studies? However, our brief said that we need approval from NIH to start animal studies. So if you have, Well, yes, you do need to have approval, right? So you can have an external ICOOC. There are different ways to handle animal research if you don't have your own animal approval committee at your institution, right? There are different mechanisms for things like issuing a memorandum of understanding to have work done at a different site. We've had this happen within Kentucky. We're also an INBRI state. So we've had institutions that do not have an animal care and use program, and they have negotiated with other institutions that do to either provide oversight of that or to do some of the work there. So there are mechanisms to deal with this. If I
The
okay.
next one, Paul, I'm gonna let you take a stab at that as somebody who serves on a study section. If I propose to collect the blood and give an estimate, how close do I have to stay with that estimate? What if I need more volunteers than previously anticipated? If I don't need as much, do I have to give the justification why I did not use as many subjects as I proposed? So Paul, that I think falls in the review area and some of that.
So when you're writing a proposal and any sort of thing where you're proposing use of samples of any kind, human or animal, you're only expected to give a reasonable approximation of what it is that you're doing and provide a justification for why you think this would be sufficient. So everyone knows there's going to be a little bit of wiggle room in there and that you have to propose a realistic estimate. So there's kind of a balance between those, right? I mean, if you've got, um, if you're proposing a ridiculously large amount of blood, that might give reviewers pause and say that that does not seem possible, or it seems incredibly inconvenient or unlikely that you would ever be able to do that. It's the same thing if you were doing an animal study and so that you have a 4-year grant and you're planning on using, 100,000 mice, and so that seems that it's not possible based on the resources that are available to you. Right. You can give a range of how many samples you think you might need and volume wise. There are guidelines for these, like how much you can draw on a given day, right, from a given person, and that sort of thing. And that's fine. You don't usually are not faulted for giving estimates of a range that way. When they just look to see, does it seem what you're doing is plausible and reasonable for what it is that you're proposing.
Okay, so the next one, does burnout, well-being fall into a health-related behavior? Yes, that could. However, what you want to make sure is whatever health-related behavioral or biomedical outcome you are studying is something that is within the mission priority of an NIH institute. So for example, you would really want to feel that NIH has an interest in funding research on that particular behavioral or biomedical outcome.
Okay. Can you describe a situation where an MOU would be used? Okay, this is not an institution specific thing. This is an NIH requirement. So the most common situation is where you are contracting out an activity that you do not have the capability of doing at your institution. So for instance, you are doing something where, let's say we're dealing with an animal project and you are buying animals from something like Charles River or Jackson Labs, and they are doing the surgical procedure for you. So let's say you're studying hormonal regulation of behavior and you're having Jackson Labs overectomize or gyectomize the mice and ship them to you. So what you would have is a memorandum of understanding with Jackson Labs that they are performing the surgical procedures that are on your grant proposal, and they have their own ICOOC. And the memorandum of understanding basically indicates that they are responsible for the animal care and oversight, and you are responsible for paying for the service, that sort of thing. This is true of anything where you're doing work offsite and contract. That's generally where it comes from. The memorandum of understanding just is really outlining who is responsible for what, like where the oversight lies. You have similar things for human studies too, right? You have to have someone has to outline who is responsible for what.
So Paul, the next one is about mentor for sure first. I think maybe that's something in your area.
Let's see. I have a question. Sure, first, my current institution does not have someone that can introduce a mentor. Is it all right to list my previous mentor from our one institution in another state? Do I need to expand the application related to that institution? Okay. So we get these sort of questions a lot. I think we're almost out of time, but I can cover this really briefly. If not, you can email me and we can talk in depth separately. So there are a couple of considerations. You're having your previous mentor continue to serve as a mentor when you're an independent researcher is often not a good idea, because the mentor is supposed to be helping you learn new ways of being an independent researcher, right? Learning you how to administer a lab, how to work with students, whatever your mentor is doing for you on that application, right, is somehow has to be actually giving you something or teaching you something you don't know. Now, you can make a case for your previous mentor continue to be a mentor, right? But it's hard to make. You could say, for instance, that my previous mentor, we never talked about managing a lab, and now they're going to help me learn about managing stuff. But you could be criticized, saying, "Well, why didn't they think to teach you that? That doesn't sound like they're very good." Right? So be careful with that. It's not impossible, but it's probably a higher bar. There is no requirement that your mentor be at your current institution. Generally, NIH prefers that your mentor onshore first, be NIH funded, so that they can help you to be, guide through various aspects of the funding process and how to, for example, manage a grant. But that is also not required. So they could be NSF funded or something like that. That's okay. But NIH funding is preferred. You do not need to pay them, right? In fact, that's usually not necessary at all. They're just on there as a mentor, right? You could pay them. There's nothing stopping you from paying them a percent of their effort. Some ways, some reviewers consider that to be a good thing, because when someone writes you a letter saying they agree to do something, but there's no effort on the grant for it, that's still fine. But if someone is willing to say that you're going to pay me for 5% of my time because there's actual resources involved, a lot of reviewers view that as being a much more significant commitment, because they've essentially promised you a specific amount of time, right? Whereas a letter is just saying, well, I'll help where I can, right? Both can work. Just remember, the last thing on that is that be careful with your use of resources, because the R16 program is meant to be building sustainable research at your institution. And the more resources you direct away to other institutions, the less of that you're getting, right? Because you're not directing the resources towards your institution to build research capacity, you're giving it to somewhere else. And if you're giving it to someone in the R1 institution, they don't need that. So it's perfectly fine to do that. Just don't do too much of it. And I think that was our last question.
That's it. Thank you all so much.
Thank you, everyone, for coming. Watch for the recording to go up on our YouTube channel next week sometime. And have a good rest of your day.
Yes, enjoy your day. Bye.
Bye.